Today, today we will be discussing about hydrocele. So hydrocele, that is a collection of fluid in the tunica vaginalis or anywhere in the processus vaginalis. So the development of testis. Development of testis starts in the abdomen and it is carried down to the bottom of the scrotum by a portion of peritoneal along with the portion of peritoneum. So that portion of peritoneum is called processus vaginalis. So in this diagram you can see the blue portion, that is the processus vaginalis, that's the continuation of the peritoneal cavity. It reached up to the bottom of the scrotum. After the birth of the baby, it stops at the top of testis and till the internal drain, it disappears. This will become fibrosed. That is the in the next second diagram you can see the degenerated portion of the processus vaginalis. That is the closed portion of the processus vaginalis. That is the normal thing happening. So, whenever there is persistence of the processus vaginalis, that leads to development of congenital hydrocele. That is called congenital hydrocele. So, there are so many types of hydrocele, congenital or acquired variety. So, the persistence of the processus vaginalis, that leads to development of congenital type of hydrocele. So, the next diagram, you can see the collection of fluid in the tunica vaginalis, that is called hydrocele. So definition: abnormal collection of fluid in some part of processus vaginalis, especially the tunica vaginalis, that is called hydrocele. The nature of the fluid is, it is amber colored and it contains water, salts and traces of albumin and fibrinogen. In long-standing cases, it may contain cholesterol and tyrosine crystals. Can you name any other cyst which contains cholesterol crystals? So you can see the hydrocele is the one which contains cholesterol crystals. The other two conditions are branchial cyst in the neck and dentigerous cyst in the oral cavity. What is dentigerous cyst? That is cyst developed in unerupted tooth in the mandible. So especially it is seen in the lower jaw. Unerupted tooth in the gums, it can produce a cyst in the lower jaw, that is called dentigerous cyst. It also contains cholesterol crystals. This nature of this hydrocele fluid is, it doesn't clot. Even though it contains fibrinogen, it doesn't clot. But when it comes in contact with the blood, because of the presence of fibrinogen, the hydrocele fluid clots. So coming to the etiology of hydrocele. So whenever there is collection of fluid anywhere in the body, that is, one reason is due to decrease in absorption of the fluid produced from that area, or maybe due to increased production from that site due to some infections or due to some irritation or due to some tumors. So that also leads to collection of fluid in that area, or maybe due to interference with lymphatic drainage of the scrotal structures, or due to connection with the peritoneal cavity. So these are the four reasons where you get hydrocele. So one is decrease in absorption of the fluid produced by the tunica vaginalis, that is most common reason for primary type of hydrocele, and increased production due to some infections like tuberculosis, leprosy, syphilis, or due to trauma. These are the causes for secondary type of hydrocele. And due to interference with the lymphatic drainage of scrotal structures, that is especially in filarial hydrocele. And whenever there is a connection with the peritoneal cavity, this fluid from the peritoneal cavity that will collect in the scrotum, that is called congenital type of hydrocele. So coming to the classification of the hydrocele, there are congenital variety and acquired variety. In congenital variety, there are four types of congenital variety of hydrocele, and in acquired variety, primary and secondary. Primary, I have already told you that due to decrease in absorption of the fluid produced by the tunica vaginalis, that is the reason is unknown. That is the most common type of hydrocele. And in acquired variety is a primary and secondary type. Secondary type, that is due to some infections of the testis like tuberculosis, then syphilis, leprosy, then tumors of the testis, then maybe because of trauma, it can produce more production of fluid by the tunica vaginalis, that leads to development of the secondary type of hydrocele. And interference with the lymphatic drainage of scrotal structures, that is especially seen in filarial hydrocele. And connection with the peritoneal cavity leads to congenital variety of hydrocele. So congenital types of hydrocele are four types. One is vaginal hydrocele, congenital hydrocele, infantile hydrocele, and encysted hydrocele. So vaginal hydrocele, that is due to increased production of fluid by the tunica vaginalis. So it is a vaginal hydrocele. Then congenital hydrocele is the communication with the peritoneal cavity is there. So there will be collection of fluid from the peritoneal cavity to the scrotum. And infantile hydrocele, that is the processus vaginalis extend up to the internal ring, so that there will be collected fluid will be there in the processus vaginalis. So that type of hydrocele is infantile hydrocele. Then encysted hydrocele means some part of processus vaginalis become persistently open, and that part will produce fluid to produce an encysted hydrocele or a cyst-like structure in the cord, that is called encysted hydrocele. So these are the 4 types of congenital hydrocele. So vaginal hydrocele, infantile hydrocele, congenital hydrocele, and hydrocele of the cord. Vaginal hydrocele, fluid accumulates in the tunica vaginalis. Depending upon the change in the form of tunica vaginalis, it can be bilocular, hourglass, or multilocular type. That is, I want to show you this diagram. This is bilocular hydrocele. So the processus vaginalis is patent till the internal or the external ring. So this whole part, again, it constricted at so many sites to produce a hourglass appearance or multilocated feel. So that is called bilocular hydrocele. That's a type of infantile. That is a type of vaginal hydrocele. Then coming to congenital hydrocele, it communicates to the peritoneal cavity through a small orifice through which the peritoneal fluid only comes out. The bowel will not come out. Hydrocele of the cord, that is the cyst seen along the spermatic cord. I have already told you that some part of processus vaginalis is patent and it can produce fluid. That collection of fluid in the spermatic cord is called hydrocele of the cord. So traction test is the test which helps to identify that this is not a lipoma or any other swelling in the scrotum, but it is only hydrocele of the cord, because it is attached to the cord. So when you give traction to the testis, the swelling become less mobile. If it is a lipoma of the cord, there is no tension over the swelling. Again, this will give mobility over the spermatic cord. But in case of hydrocele of the cord, it will become less mobile while giving traction to the testis. That is how you identify hydrocele of the cord from lipoma of the cord. Acquired variety, primary and secondary types. Primary variety, the reason is unknown. Secondary variety, I already told you the reasons, like tuberculosis, mumps, filariasis, trauma, tumors of the testis, or any infection. So there are some points to distinguish between primary hydrocele and secondary hydroceles that I already mentioned. Then testicular sensations are lost in malignancy of testis. That is also one type of secondary hydrocele. So secondary hydrocele occurs as a result of testicular tumor. When you palpate the testis, the patient may not feel the testicular sensation. So testicular sensation is one of the important point to find out this secondary hydrocele is because of any testicular malignancy or due to any other infections of the tunica vaginalis or testis. So testicular sensation lost in so many conditions like testicular malignancy, syphilitic orchitis, lepromatous orchitis, and chronic hematoma. So I just want to mention some swellings which are brilliantly transluminant. The primary hydrocele, which is brilliantly transluminant. There are other swellings like cystic hygroma, ranula, and meningocele. Just like hydrocele, vaginal hydrocele, and epididymal cyst, these are the 3 other conditions where you get brilliantly transluminant swellings. So what all investigations you do to find out or to confirm the hydrocele? The only investigation is the USG of abdomen and scrotum. So what are the differential diagnoses? Inguinoscrotal swellings. Inguinal hernia extends up to the scrotum of the patient, to the bottom of the scrotum. That swelling is called inguinoscrotal swelling. So how will you distinguish between these two is, if you can get above the swelling, from the scrotal swelling, if you palpate the swelling and if you can feel the cord above the swelling, that means it is purely scrotal swelling. Because of the hernial content, you cannot insinuate your two fingers felt at the root of scrotum. So that case, we have to conclude that if you cannot feel above the swelling, that means it is an inguinoscrotal swelling. Epididymal cyst, this is another differential diagnosis. So inguinoscrotal swelling, I have written it as inguinal scrotal swelling. It is, you have to read it as inguinoscrotal swelling. Okay. So epididymal cyst, that is another differential diagnosis. Scrotal edema. So as a part of ascites, then cellulitis, the patient can develop scrotal edema. So in that scrotal edema also we may think that is a case of hydrocele. So this scrotal edema is only subcutaneous swelling. It is not arising from the tunica vaginalis. So that time this also comes as a differential diagnosis. Then large testicular tumors, the scrotum will be swollen. So that you have to distinguish from a hydrocele. So these are the differential diagnosis: inguinoscrotal swelling, epididymal cyst, scrotal edema due to cellulitis or ascites, and testicular tumor. So when you go through this chart, if you can get above the swelling, that means it is purely a scrotal swelling. So that can the testis be felt separately from the swelling? Yes, that means it is testicular tumor or epididymal cyst or spermatocele. And if you cannot separately feel testis from the hydrocele swelling, that means that time you have to look for translumination test. If it is brilliantly transluminant, that means it can be vaginal hydrocele or an epididymal cyst. If it is not brilliantly transluminant, that means it is an hydrocele which is long-standing or infected. If you cannot get above the swelling, that means it is a case of hernia. So that time you have to look for cough impulse. Cough impulse present, that means it is an inguinal hernia. No cough impulse, that means it is a case of infantile hydrocele. So these are the that is how you distinguish a scrotal swelling from inguinoscrotal swelling. Even if it is a scrotal swelling, if you can separately palpate the testis from scrotal swelling, that means it is a case of testicular tumor or an epididymal cyst or an spermatocele. So when you get a absent translumination test, in long-standing case of hydrocele, because of the calcification of this sac, you will get absent translumination. If the fluid inside the hydrocele is infected, you will not get a translumination. Chylocele, hematocele, means collection of blood also in the tunica vaginalis, you will not get a translumination test. Then what are the complications of hydrocele? Infection leading to pyocele, hematocele, trauma. Because of the huge swelling, it can leads to trauma and leads to hematocele. Then long-standing cases, calcifications can occur because of the presence of fibrinogen and all. Then because of the high pressure by the fluid, it can lead to loss of blood supply to the testis and atrophy of the testis. Then rupture of the hydrocele due to trauma. Then hernia of the hydrocele. From this, it can open at one side and it can leads to collection of fluid outside the tunica vaginalis, that is the hernia of hydrocele. These are the complications of hydrocele. Then what all surgeries you prefer? So the only the option for treatment is surgery. So surgical options are eversion procedure or plication. So the fluid is produced by the tunica vaginalis. So either you have to open the tunica vaginalis and evert it, so that whatever fluid produced by the tunica vaginalis, that will go to the subcutaneous tissue of the scrotum. or you can do plication of the tunica vaginalis to reduce the surface area. When you open the tunica vaginalis and evert it, and then you evert it and plicate it to reduce the surface area of the tunica vaginalis. That eversion procedure is called Jabulais eversion procedure, and plication technique is called Lord's plication procedure. The excision, previously we used to do excision procedure, excision of the tunica vaginalis, but nowadays we are not doing that procedure because it can lead to hematoma formation of the scrotum post-operatively. Then another technique is less traumatic technique, that is Sharma and Javer's technique. That is just like Lord's procedure, but the thing is, instead of putting in the scrotal cavity, we produce another cavity in the dartos. We make a pouch in the dartos muscle and keep the testis in that dartos pouch. So that is called Sharma and Javer's technique. Then one word about epididymal cyst and spermatocele. This epididymal cyst is a congenital type. It's a cystic degeneration of the paradidymis, organ of Geraldis. So here comes the difference between the epididymal cyst and spermatocele. Epididymal cyst is congenital. The other one is acquired retention cyst. That is due to blockage of the tubes from the production center of the spermatozoa to the vas deferens through the seminal vesicles. Whether that time it can produce retention cyst. And it is seen, epididymal cyst is seen behind and above the testis, behind the body of testis. The other one is epididymal cyst is multilocular, spermatocele is unilocular, and a bunch of grape appearance and contains clear fluid. Here it is barley water fluid and it contains sperm. So it is also called a third testis. It is brilliantly transluminant, the epididymal cyst, and it giving a Chinese lantern appearance because of the multiloculation. It gives a Chinese lantern pattern on translumination. And the other one is also spermatocele, also transluminant. And excision can be should be avoided in young patient in the case of epididymal cyst, and spermatocele can be excised. So in a case of scrotal swelling, to get a diagnosis, so what all things you have to ask in the history and while doing clinical examination. Can you get above the swelling? Yes or no? Then can you identify the testis and epididymis separately from the swelling? Yes or no? Is the swelling transluminant or translucent? Is the swelling tender or not? These 4 questions you have to ask and find out the reason. Then only you can come to a diagnosis. So swelling in the scrotum. So you can go through this chart and find out the reasons and how to come to a conclusion. Okay, that is all about hydrocele. Okay, thank you. Bye.